Alzheimer's disease is a brain condition that gradually worsens over time. It's caused by changes in the brain that lead to the accumulation of certain proteins. These changes shrink the brain and damage brain cells, leading to memory loss, thinking problems, and behavioral issues. Alzheimer's disease is the most common type of dementia, a condition characterized by decline in memory, thinking, and social abilities. It affects about 6.5 million Americans over the age of 65, and more than 70% of those affected are 75 or older. Symptoms: memory loss. This is the most noticeable symptom. Early on, it may be forgetting recent events or conversations. As the disease progresses, memory loss worsens and affects daily functioning. Difficulty thinking and reasoning. Concentration and problem-solving become challenging, especially with abstract concepts. Impaired decision-making. Making sensible decisions and judgments becomes difficult in everyday situations. Trouble planning and performing familiar tasks. Simple tasks that once came easily, such as cooking a meal, now become a struggle. Personality and behavioral changes. Mood swings, depression, social withdrawal, and changes in sleep patterns are common. Preserved skills. Despite these difficulties, people with Alzheimer's may retain certain abilities such as reading, singing, or playing games for longer. Causes. The exact cause of Alzheimer's disease is unknown, but researchers believe it involves a combination of genetic, lifestyle, and environmental factors. In most cases, the development of the disease begins years before symptoms appear, and the damage usually starts in the brain region controlling memory. Two proteins play a key role in the disease. Plaques. When fragments of a protein called beta amyloid clump together, they form plaques that can damage and disrupt communication between brain cells. Tangles. Tau proteins, which normally support brain cells, change shape and form tangles that interfere with cell function and cause damage. Risk factors. Age. Age is the greatest risk factor for Alzheimer's. The risk increases with each passing year. Family history. Having a first-degree relative with Alzheimer's increases your risk. Genetics. A specific gene called APOE4 increases the risk. Down syndrome. People with Down syndrome have a higher risk of developing Alzheimer's. Sex. Women are more likely to have Alzheimer's than men due to their longer life expectancy. Mild cognitive impairment, MCI. A condition that affects memory or thinking more than normal for age, MCI can increase the risk of developing dementia, including Alzheimer's. Head trauma. Severe or multiple head injuries increase the risk. Air pollution. Exposure to air pollution, especially from traffic exhaust, is linked to an increased risk. Excessive alcohol consumption. Heavy drinking is associated with an elevated risk. Poor sleep patterns. Trouble sleeping is linked to an increased risk. Lifestyle and heart health. Factors such as lack of exercise, obesity, high blood pressure, high cholesterol, and poorly controlled diabetes can increase the risk. Lifelong learning and social engagement. Engaging in mentally stimulating activities and socializing throughout life may lower the risk. Complications. Alzheimer's symptoms can make it difficult to manage other health conditions, leading to complications such as difficulty communicating pain or symptoms, inhaling food or liquid into the lungs, increased risk of infections, falls and fractures, bed sores, poor nutrition or dehydration, dental problems. Prevention. There is no sure way to prevent Alzheimer's disease, but certain lifestyle modifications may reduce the risk. Exercise regularly. Eat a healthy diet low in saturated fat. Manage blood pressure, diabetes.